Botox injection, and we have Rachel as our model here. Just a little quick information about Botox. Botox is a muscle paralytic. Basically, it's used in the forehead area in between the eyebrows where you have those 11 lines at the crow's feet, and sometimes the bunny lines, which we're going to do on Rachel today, to weaken those muscles so you don't keep making those expressions over time, which results in those very deep lines. A lot of people ask what is the good age to start doing Botox. There's really not a definite age, obviously after 18, but it depends on you, how much lines you have and how exaggerated those lines are. In some people, they're in their 40s and they don't have anything, and in some people, even in their 20s, they start having deeper lines, those expression lines. So it's always a good idea to start it early so you don't make them deeper and deeper. Botox is actually botulinum toxin A. Today we're going to use actually brand name Botox by Allergan. This is an FDA approved product. Obviously you need to be at a credible place for that, but it's an FDA approved product for the purposes of weakening the muscles. It usually lasts about 3 to 4 months when you start noticing that those expression lines are getting a little bit stronger and coming back, and that's when we usually suggest to patients to come back about that time. Now some people, when they're more active or just their body metabolizes a little faster, some people they metabolize it a little slower so they can space it out, but you always usually want to make sure it doesn't go completely back to what it was before you come and get the injections. People that are more regular, they find themselves throughout the time that they are able to space it out a little more because the muscles, they've been getting the injections often enough that the muscles are a little bit weaker and weaker. So Botox comes in a sterile vial. It's meant to be a one-time use vial. We have the 50 unit here, and we're gonna use all of that for Rachel. And it comes as a white powder on the bottom of it. It's frozen, and it's reconstituted with normal saline that there's a specific amount you're supposed to mix it with to make it into the liquid form. Let me stop taking. Okay, so here we have Rachel. She has had Botox in the past, so she's here for her 3 to 4 month visit. With every patient, we usually ask what they like. If it's their first time, we explain it and do a trial and error, but in her case, she knows exactly how she likes her Botox. So we're gonna focus on the forehead area, which is the frontalis muscle, which raise your eyebrows up, which basically gives you those wrinkles on your forehead, and you can see she still has some leftover Botox. But in her case, and also my case, we like we like to have that arch on our eyebrows, so we kind of stop short of going all the way to the side. And that works for some people, sometimes it doesn't, because some people get really high peaks and you just have to put a little bit more. The second place that we're gonna put it is that front, these middle 11 lines, and you can relax. So everybody gets those angry 11 lines, so we're gonna put it in the muscle here and 2 little muscles on the sides that do that. And obviously the crow's feet, because when we weaken this muscle, it helps for this part to pull up her eyebrow a little bit. And in her case, she likes to have her bunny lines done, which are these little ones, and hers pretty strong little bunnies on there. And so we're gonna wipe all the areas that we're gonna inject with some alcohol. Making an angry face and relax. So now we're gonna do the crow's feet. Can you grab a little bit for me? Gonna feel the edge of the bone. And gonna inject the first one in the tail, where her eyebrow is. That's what's gonna help her get that. And one further down. Alright, show me your bunny line. Alright, relax. And we're gonna go on the other side. Same thing again. I'm gonna go for the tail of her eyebrow. Any pain at all? And then show me your bunny line. Alright, relax. And a little bit left. So as you can see, we did inject all the areas. For her, it looks like little tiny mosquito bites. Some of them on her, you can't even see it, but in some people, a little bit more obvious. So Botox takes usually about a week to 2 weeks to kick in, and somebody like her who's been getting it regularly, maybe a little bit sooner, especially someone that's their first time, or men, it might take a little bit longer, but we usually say wait about 2 weeks. Sometimes like one side of the face kicks in a little bit faster, so don't be alarmed if one of those lines look a little bit asymmetrical at the beginning. Usually we tell everybody don't put any makeup on, no alcohol for the day of no strenuous activity, and from the next day you can pretty much do whatever you want. Everything good?